Since I briefly suggested in a previous video that folks get to know their representatives, I thought I'd share about a recent field trip I took. This past week, I had the privilege of attending a Black Maternal Health Legislative Advocacy Day at the Georgia State Capitol. This event was coordinated by several reproductive justice organizations working together to improve the maternal health outcomes of Black women and birthing people in the state.
Hey y'all, Shanti here for Black Maternal Health Legislative Advocacy Day here at the Georgia State Capitol. And we're gonna go talk to some legislators about some bills that are being proposed. Check back in later.
It was a cold morning by Atlanta standards, but folks were up and ready to speak with their legislators about the policies affecting Black maternal health in Georgia. Even though I've talked previously about the importance of getting involved in the legislative process, I truly understand how intimidating it can be. I've been advocating for maternal health at the Georgia State Capitol since 2019, and I'm still finding my footing in this space. It's always busy and bustling, with most folks giving the appearance that they don't have much time to talk. Nevertheless, as Representative Schofield says, this is the people's house, meaning the constituents being represented belong there. I appreciate that perspective because it reminds me that I have every right to be in that space. We had the opportunity to visit our representatives in their offices, schedule appointments if they weren't, or meet with them briefly on the ropes to talk about our concerns, all of which was followed by a press conference. We also got to hear from representatives who champion our efforts, but spoke candidly about some of the challenges we're facing. Y'all, there are people working on legislation to make miscarriage a felony. That's wild. But all the more reason why we need to stay woke. And yes, that was an intentional example of how to properly use that phrase. Some of the changes that I'd like to see made in Georgia are options for licensure for certified professional midwives, certified midwives, and traditional midwives. I'd also like to see certified nurse midwives have full practice authority and not be beholden to collaborative agreements with doctors. I'd like to see families receive paid family leave. And I'd also like to see Medicaid expansion so that people can get reproductive health care in the preconception period. I'd like to see the expansion of abortion care access and the protection of gender-affirming care. What changes concerning maternal and reproductive health would you like to see made in your state?